Welcome to This Explainer. Today we're diving into something that, let's face it, touches millions of families worldwide. We're taking a really close, comprehensive look at Alzheimer's disease. Now, it's the most common cause of dementia, but it's important to understand this is a progressive brain disorder that doesn't just happen overnight. Instead, it gradually and relentlessly destroys memory, thinking skills, and eventually the ability to perform even the simplest of daily functions. Our goal today is to unpack the science, understand the progression, and really look at the human side of this disease. So you or a loved one misplaces the car keys for the third time in a week, and immediately that question pops up. Is this just a normal part of getting older? Well, the definitive answer is no. We need to firmly separate Alzheimer's from normal aging. Look, occasional forgetfulness happens to all of us. That's just life. But Alzheimer's is a distinct, progressive neurodegenerative disease. It's not just getting older. Grasping that distinction is the absolutely crucial first step in demystifying the condition.
Okay, let's dive right into this. Today we're covering understanding Alzheimer's disease, looking inside the affected brain, mapping out the stages of progression, going through diagnosis and medical management, and finally, caregiving and risk reduction.
Section 1. Understanding Alzheimer's disease. So, Alzheimer's is clinically defined as a neurodegenerative disease. Sure, that sounds like a lot of medical jargon, but what it essentially means is the gradual progressive death of brain cells over time. And this cellular death, it's the engine driving the entire disease. It's exactly what causes the impaired memory, the disrupted thinking and reasoning, and those profound changes in behavior. The brain is, quite literally, losing its processing units, which is exactly why cognitive functions begin to shut down. And when we talk about who is affected, the number 65 is incredibly significant. The vast majority of Alzheimer's cases occur in individuals who are 65 years of age and older, and that risk jumps significantly as we age. But, and this is a big but, it's crucial to note that it can strike earlier. Early onset Alzheimer's can affect both men and women in their 50s or even 40s. It doesn't discriminate by gender, though advanced age absolutely remains the primary risk factor. Moving to Section 2. Inside the affected brain. There is literally a microscopic battle happening right inside the brain. Researchers focus heavily on two main culprits here: amyloid plaques and tau tangles. Think of your brain's neural network like a bustling, interconnected city. Amyloid plaques are these abnormal protein deposits that act like massive roadblocks building up right between the brain cells, completely blocking neurons from communicating with one another. Then, on the flip side, you have tau tangles happening inside the cells. Normal tau proteins are like straight, efficient supply highways. But in Alzheimer's, they collapse into these tangled messes, disrupting the transport of essential nutrients. So cells are simultaneously blocked from talking to their neighbors and literally starving from the inside out. Because of those plaques and tangles we just talked about, we see a progressive loss of neurons. And when those cells die off in massive numbers, it leads directly to brain shrinkage, which is clinically known as atrophy. The microscopic damage directly translates to the physical shrinking of the brain itself. As the brain loses mass, its overall function is significantly and permanently reduced. Which brings us to Section 3, the stages of progression. You know, Alzheimer's isn't just a sudden switch that gets flipped. It's a long, incredibly difficult journey that generally unfolds in distinct phases. In the early years, the primary issue is memory problems and mild confusion. Moving into the middle years, symptoms become moderate and really start interfering with daily life. Finally, in the later years, the patient experiences advanced symptoms resulting in complete dependence. Let's break these stages down a bit further. The absolute crucial point here is knowing what to look out for early on. Early symptoms can honestly just mimic being distracted, but they form a persistent pattern. We're talking about forgetting very recent conversations or struggling to learn new information. It's consistently misplacing everyday objects in strange places. A major hallmark you might actually notice is a loved one repeatedly asking the exact same questions within a super short time frame, or constantly struggling to find the right word in a totally simple sentence. As the disease relentlessly marches forward, the symptoms get much more severe. In the moderate stage, you might start seeing wandering behavior, where a patient gets completely lost in their own neighborhood. Personality changes kick in too. Someone who was always gentle might suddenly become anxious, irritable, or deeply depressed. By the advanced stages, the disease forces complete dependence on caregivers. Patients experience severe memory impairment, they lose the ability to recognize their own family members, their communication skills fade, and eventually they struggle with basic physical tasks like swallowing or walking. It's a profoundly difficult stage that leaves them highly vulnerable to complications like falls or infections. Let's move to Section 4, Diagnosis and Medical Management.
So, how do we build to a diagnosis? The clinical pathway for making an official diagnosis is a step-by-step, incredibly thorough process. First, doctors have to differentiate Alzheimer's from other reversible causes of memory loss, like a vitamin deficiency or maybe thyroid issues. They start with a detailed medical history and a physical exam. Then, they deploy cognitive and neurological tests, like the mini mental state examination, to gauge memory and thinking skills. Finally, they use brain scans, like MRIs or CT scans, alongside blood tests to rule out other conditions and actually look for those physical signs of brain atrophy we discussed earlier.
Once a diagnosis is made, the conversation immediately turns to medical management. And I want to be really clear about this up front. Right now, there is no cure for Alzheimer's. However, under physician supervision, we do have medications available, things like donepezil, rivastigmine, galantamine, and memantine. Now, these drugs aren't going to stop the underlying cellular death, but they can be absolutely invaluable in managing symptoms, temporarily improving cognitive function, and potentially slowing down the progression of the disease for a time. And that leads us to Section 5, Caregiving and Risk Reduction.
Empowering the patient is absolutely critical here. It's not just about medication. Non-medical management plays a massive role in maintaining quality of life. This means actively engaging the brain through cognitive stimulation, doing puzzles, reading, keeping up social engagement. It means regular physical activity, like walking or light strength training, combined with a healthy diet rich in whole grains and healthy fats. Good sleep hygiene is basically non-negotiable, and we really can't overstate the role of physiotherapy. It is vital for improving balance, preventing dangerous falls, and preserving the patient's physical independence for as long as possible.
But listen, we absolutely cannot talk about Alzheimer's without talking about the caregivers. The emotional and physical toll on family members is immense. Effective caregiving requires a seemingly infinite well of patience. Establishing strict daily routines really helps ground the patient. Maintaining a safe environment to prevent wandering or injury becomes a constant vigil. But crucially, caregivers also have to provide emotional support while recognizing when they themselves need assistance. Nobody can or should carry the weight of caregiving entirely alone. Now, what's really interesting about this is how much power we actually have over our own risk factors before the disease ever takes root. Sure, we can't change our genetics or our age, but we can actively reduce our risk. A good rule of thumb: what's good for the heart is good for the brain. Engaging in regular exercise, aggressively controlling your blood pressure, managing diabetes, keeping your mind stimulated, and absolutely avoiding smoking, these are proven lifestyle choices that actively defend our brain health. I really want to emphasize a crucial perspective right now. Early diagnosis improves management and planning. Many patients live for years after a diagnosis. Yes, an Alzheimer's diagnosis is devastating, there's no sugarcoating that, but it is not an immediate end. Recognizing the early symptoms and getting a prompt diagnosis buys you precious time. It allows the patient to actually have a voice in their future care, to start symptom management early, and to share many more meaningful years with their families. Which leads us to a final thought for today. Alzheimer's is a medical reality for sure, but the journey of walking through it, well, that's deeply human and communal. As we've seen today through the science and the symptoms, it's a heavy burden. So I leave you with this question to ponder. How can we better support caregivers and patients in our communities to ensure they never have to face this journey alone? Thank you so much for joining me for this explainer. Until next time, keep learning and keep asking questions.